My name is Devashni Bharatharaju and today I will be doing Physics ISU. So I've decided to become a doctor when I grow older. Today I've decided to interview a general practitioner. Hello.
Hello.
Are you ready?
Yes.
What is your name and what do you do?
My name is Dr. Rasi. I'm a general practitioner. I basically work in a clinic in Gombak area.
I see. Please briefly explain what you do as your job.
Okay, my job is to see patients and treat them. So being a general practitioner is more like family medicine. So we not only see adults, we also see children, and we also manage emergency cases like if someone falls on accident. We do some stitching, cleaning, dressing wounds, giving the necessary medication. And we not only deal with children, we also deal with infants also. And it's also not we're not only dealing with physical problems, but we're also dealing with mental problems. Sometimes people have issues or home problems, so we try to speak to them, give them counseling. So it's like being able to do everything. And that's what's the general practitioner's job.
At which point of your life did you decide to become a general practitioner?
Actually, the main thing was I decided to become a pediatrician, but my main aim was to become a doctor. So at the age of 5, when it started.
Why did you not become a pediatrician?
For many reasons, we shall not go there.
Were you influenced by anyone?
My uncles, because I thought most doctors were very good and kind and compassionate. So that's the reason why I thought being a doctor would be really helpful to others.
Do you not believe that all doctors are kind and helpful?
I hope so, all are.
In your opinion, what is the most important and essential skill needed in this career?
Kindness, compassion, and a bit more understanding. And of course, knowledge. Knowledge is very important. So you need to know you need to know your medicine. You need to know what you are dealing with. If you don't have knowledge, you don't have anything. So you need to know what you're doing.
Nice. Why compassionate?
Compassionate because sometimes people will come with so many problems. Sometimes they will beat around the bush before really coming to what is their main issues in their life. So you need to be patient and compassionate and listen to them.
How did physics help and affect you as you work to become a general practitioner?
Physics is one of the subjects. It's a very important subject for you to gain admission in most colleges. So, and the way I look at it, physics is basically now at this moment is more into our diagnostic. So is you're able to use physics in your MRIs, in your CT scans, in your robotic surgery, in all other aspects where it makes being a doctor easier and helping you to make better diagnosis.
How much is physics related to your career and how do you use and apply it in your daily life as a general practitioner?
Okay, as a general practitioner, not so much. Maybe we look into the instruments that you use. For example, your otoscope is in your clinic setting. Otoscope, the ophthalmoscope, the stethoscope, your thermometer where you use the mercury, and then maybe you can do minor laser surgery, and then you could do maybe cauterization of more blood vessels where you
That
use it.
includes physics?
Yeah, includes physics.
Okay.
Because it's heat, energy. So that's how you use it. It's heat, energy.
What do you think is the most common danger in human health today?
Common danger in human health is basically they themselves, I would say. They do not look after themselves, they don't exercise, their diets are wrong. So that affects their health basically. So it's generally it's they themselves is their major problem.
What about illnesses?
Okay, illness, a lot of illness. But in Malaysia, basically dengue is a major issue. So because of the mosquito, the breeding grounds, people not keeping their homes clean and water not, making sure there's no water that is stagnant. All this, it plays a part.
Would you choose your career again if you had a second chance?
Yeah, I wouldn't change my career. I would prefer to maintain because it's my passion.
Why do you think you don't apply physics in what you do?
I think we do apply physics, but not to that extent where, because this skill is basically uh, treatment. Okay, but it helps a lot. Without it, you cannot manage yourself.
Physics or
Yeah.
treatment?
In treatment, to find the treatment, you must make the right diagnosis. So to make a right diagnosis, you need physics.
How so?
Your MRI, your X-ray. Let's say you get a person with cough and flu, and you're thinking of TB. So how to make a diagnosis of TB? You have to do a chest X-ray, which is your X-ray. So the X-ray will show you whether this is TB or is it pneumonia or something else. Then you have your MRI. So now you're looking for something deeper. So you go for an MRI. Then what else do you have?
Do you personally do these tests?
No. We send them to a hospital or a diagnostic center where they have, because these machines are big machines, so they need to have a certain setting. So they have technicians who deal with, who must have a little knowledge of physics to deal with these machines.
Do you have any advice for future general practitioners?
Okay, future general practitioners, don't always think within the box, think out of the box. Be compassionate, be understanding, and please know your work, and keep with the times. Read up, always read, so that because everything is changing. So today's poison is tomorrow's food, and today's food can be tomorrow's poison. So that's how medicine is. What we know today might not be right for tomorrow, and what we think is a poison is tomorrow could be a cure.
Off the top of your head, what job can you think of uses physics?
Okay, for me, I think you would look into you call it rockets. Going out of out of the earth. So those are the ones that use a lot of physics. And even forming the black hole. That uses a lot of physics also. So for me, I think those jobs are very interesting because you're going into the unknown, things that you don't realize, and physics is part of it.
Can you explain how astronauts use physics?
I think you didn't say astronauts use shuttle. They need to use their console, gravity. They have to know anti-gravity thing. That's part of physics, isn't it?
Yes.
So their consoles also uses physics, how to monitor, how to manipulate. They have even machines that help them to manipulate certain of their
tests
and
go into.
And they have those machines when they repair when in the space, isn't it? Those have to use physics, isn't it?
How would you define physics?
How do you define physics? Physics is the beginning of everything, like your black hole. It goes into the unknown. So you go deeper and deeper, it becomes more interesting. But sometimes a lot of things in physics is not really, you can see it,
So can you please summarize how physics is related to your job? Okay.
Physics has made my job easier. Okay, so if I do not know something and I think that it is something, I can go further by doing a lot of diagnostic tests. So I can send them for the MRI or the CT scan or the X-ray or certain other procedures. Also now people, when you have to go for operations, they don't have to be very afraid because they think that they have to make a large incision. But with physics, we have a laparoscope. We have laparoscopic surgery. We have cameras that you can put into people to look into their abdomen. For example, you diagnosis as example someone has TB, and you want to go further. You can do a chest X-ray to check and see whether it's TB or pneumonia. Then now you can tell patients not to be afraid anymore for surgery. Major surgeries you can do a surgery like a borehole surgery, like laparoscopic surgery. You can put in a camera with a scope in, so it's small incision. Then you want to see into the colon, you can use a scope inside with a camera with it, which is all related to physics. Because of physics, we are able to move so far. And of course, with IT, computers and all that, it helps us in many ways. So it makes it easier. You don't have to base it only on what you know. You can base it a lot of things on diagnostic way.
Do you think that people who carry out these surgeries and face
laparoscopic,
do they realize that they use physics?
I think they don't.
Why?
Because you're so taken up with your skill that you forget that you're being helped by by physics itself. So you become you become master of the particular way to do a laparoscope. So you don't realize that what you're using was started by people who decided to use physics to make it easy for you. So I think most doctors do not realize that. Because the first thing they would think is chemistry, biology, those kind of things, anything that helps them. But actually physics plays a major role in medicine itself without us realizing it. By you doing this interview with me has made me realize that physics is playing a very big part in my practice without realizing.
I'm glad I made you realize
Thank you.
that physics plays a big part in your life,
Thank you.
in your job.
Yes.
This concludes our interview. Thank you for joining me today.
You're welcome. Goodbye.
Goodbye.